yet. It's on record.
Today I'm going to be talking to you about stress. Stress is something that we have all experienced at some point. Stress can occur in many different types, ways, and everyone has their own way to deal with it. Stress occurs when a physical or mental condition comes into play where a person must adapt or adjust to a new situation in their environment. This means that when the automatic nervous system activates, a stress message sends a response to your body's internal organs and glands. Long-term stress can cause a negative effect on the body, described as general adaptation syndrome or GAS. Over time, this will cause your body to become exhausted. Once your body becomes exhausted, serious health problems begin to show, such as signs of anxiety, irritability, poor judgment, or self-neglect. It can also cause high blood pressure and depression. Typically, some symptoms of stress include headaches, sleeping problems, feeling frustrated or tired constantly. Not all stress is bad stress. Sometimes stress can give you that extra motivation that you need to meet a deadline. Pressure turns into negative stress most often when the person under stress feels that they no longer have control over the situation. There is a positive correlation between meeting the demands of pressure and having a high sense of control. Stress occurs in many different types, such as acute stress, chronic stress, and episodic stress. So what exactly is acute, episodic, and chronic stress? Acute stress is your body's response to a threat, whether it be physical, emotional, or psychological. A number of things can bring on acute stress. Just the perception of threat or a traumatic event can trigger acute stress. During an acute stress response, the automatic nervous system activates. This causes your body to have an increased levels of cortisol, adrenaline, and other hormones that cause you to have an increased heart rate, increase in breathing, or even higher blood pressure. With a severe case of acute stress, one may experience PTSD, post-traumatic stress disorder. Psychological stress is most common among our society. It is said that the salt intake of a society reflects the level of stress, and that through its effect of increasing salt intake, it is an important factor in the development of hypertension. A person suffering from acute stress often will not seek treatment because their ability to mobilize and perform necessary tasks is not effective. Treatment for acute stress disorder usually includes a combination of antidepressants and short-term psychotherapy. Episodic stress, on the other hand, is where someone suffers acute stress frequently. People who suffer from episodic stress may have lives that are very disordered and full of chaos. They are always on the rush, but always late. If something can go wrong, it does. They tend to take on too much and cannot get anything organized with the constant pressure of life. Some symptoms of episodic stress can be severe headaches, migraines, hypertension, and chest pain. Treating episodic acute stress requires intervention on a number of levels, generally requiring professional help, which may take months or even years to successfully treat. Chronic stress or emotional stress occurs from having prolonged stress that you have left unmanaged. Chronic stress can affect every aspect of a person's life. People suffering from chronic stress tend to be unreasonable, they get mad easily, or act as if what they say or do is always right. They are never wrong. A person who suffers from chronic stress may not even know that they are suffering from this disorder unless someone brings it to their attention, such as a doctor or family member. Symptoms of chronic stress are almost identical to those of acute stress, but they experience over a prolonged period of time rather than just being brought on by a traumatic experience or certain event. Treatment for chronic stress is to see a doctor. Your doctor may prescribe antidepressant medications and advise you to seek help from a therapist. There are other ways of coping with stress effectively. You may want to look into some stress management tips. Some of these tips include avoiding people who cause you to be stressed. Learn how to say no. Count to 10. Adopt a healthier lifestyle. Put it in writing. Focus on the positives and try not to dwell on the negatives. Make more time for fun and relaxation. Please keep in mind that not all of these stress techniques that I've mentioned may help, and you still may have to go see a doctor. But before going to a doctor, you should at least try some of the techniques mentioned. Millions of Americans suffer from stress at some point in their lives and often forget that there are tips and other ways to manage stress. If you think you may be suffering from stress, please just don't let it go on and wait till the very last minute to take care of it. Stress plays a major part in our lives, and with the proper techniques or treatments, we can all function normally while dealing with stress of everyday life. This is my presentation, and it shows the 7 body systems that stress affects, which is your nervous system, musculoskeletal, respiratory, cardiovascular, endocrine, gastrointestinal, and reproductive. Over here I have a survey done in 2005 on BMW of their employees and where they felt they experienced the most stress. Right here is stress, the nation's #1 killer. Medically proven stress contributes to heart attacks, stroke, high blood pressure, colonitis, irritability, migraines, diabetes, fatigue, sex problems, skin disease, allergies, overeating, asthma, and breathing problems. And right here is just a little bit of stress humor. It says, the confusion created when one overrides the body's basic desire to choke the living daylights out of someone who desperately needs it. So let us recap. We'll all experience stress at some point in our lives. There are many different kinds of stress: acute, episodic, and chronic. Acute stress is the perception of threat. Episodic comes from suffering prolonged acute stress, and chronic is having untreated prolonged stress. And yet, not importantly, or finally, yet importantly, there are stress management tips out there to help you. And if those don't help, if you see a doctor or a therapist, there are medications and other treatments to help you with your stress.
Yay!
Now you can edit it for what you want.
Which one, babe?
The top one.